Hi, I'm Cameron Torabi, and today we're going to talk about the proper use of the Dentis Surgical Kit. It's a very easy system to use, and I'm going to go over each one of these instruments and twist drills. So the Dentis implant system comes with 4 lengths as far as your twist drills. So you start with a 2.2 diameter, and you have 8 millimeters, 10 millimeters, 12, and 14 millimeter twist drills. As you go across, these are increasing in your diameter sizes, so your drills are actually getting thicker. But the lengths are consistent all across. So the 2.2 comes in those 4 lengths. The 2.8, which is your next sequence of drill, it comes in also in 8, 10, 12, and 14 millimeters. Then we get to a 3.7. Now if you notice, starting 3.7, they are colorized. So you have a green, a yellow, a blue, and a purple. That means that in these sizes you actually have implants. So prior to your 3.7, basically your 2.8 and 2.2 are just preparation drills. There are no implants in that size. So then you get to your 3.7, also comes in the 4 lengths, the 8, 10, 12, and 14. Same with the 4.1, the 4.3, and the 4.8. So let's say you're planning on placing an implant that's a 4.3 by 10 millimeters. Well, you start with your 10 millimeter drill with 2.2, then you can go to your 2.8, 3.7, 4.1, and 4.3. You might want to stop early if you're in a soft bone like a D3 or D4 bone, and we'll discuss those protocols later on. Up on top over here, it says point drill. That's your lance drill. That's usually a drill that you use to start your osteotomy, just to make a little indentation in the cortex so that your actual twist drill does not bounce around when you're trying to get into the bone. That is usually something good to use, especially in the lower mandible, in the D2 bone. Now this slot is usually empty. I've placed a liniment drill, which is a side cutting drill. That's just my preference of one of the instruments to be in my kit. And the last slot is a drill extender. This extender is used, you can put it on the back of one of your twist drills, and that way it just extends your length. In case, let's say, an adjacent tooth is interfering with your drill going down to desired depth, you can place an extender to accommodate. On the bottom here, these are your implant drivers. So if you take a look, over here it says S-Clean drivers, and on here it says I-Clean drivers. In the Dentis system, two of the subsystems that they have is the S-Clean and the I-Clean. The I-Clean is tissue level, and the S-Clean is bone level. We generally use the bone level implant. It's what's mostly used. That's why I've taken out all my I-Clean drivers, which are the green ones, out of the kit. So when it comes to your implant drivers, you have 2 that are latch type that go on your contraangle. One is short, one is long. And then you also have 2 that are manual drivers that go on your torque wrench, also a short and a long. So these are your implant drivers, and these 2 are your abutment drivers. These are used to put on cover screws, healing abutments, final abutments, any kind of abutment. They also come in a short and a long. At the end over here, these are your parallel pins. You have 3 parallel pins. On one end, the thinner end, is a 2.2 diameter, which corresponds to your 2.2 drill. On the opposite side is a 2.8 diameter, which corresponds to your 2.8 drill. So after your initial drill, you want to check the angulation or the depth of your osteotomy. You can put a parallel pin and take an x-ray, a working x-ray, to see where you are and if you need to correct your osteotomy at that point. These countersink drills at the bottom are only used, they're seldom used, but they're only used if you have really hard, dense bone, and it's just to open up the coronal portion of your osteotomy so that for better ease of insertion of your implant. and that is also something that we'll discuss more in detail. The pilot drill is also a drill that I personally seldom ever use. It's something that goes between your 2.2 and your 2.8 drill, and again, that is just to widen up your osteotomy. I seldom ever use it. When you remove the top tray, underneath you have two instruments. One is your measuring gauge, the other one is your torque wrench. The measuring gauge comes with laser markings at 6, 8, 10, 12, 14, and 16 millimeter depth. This is something you use to measure the depth of your osteotomy. And your torque wrench is can be used on the back of your implant driver when you want to measure the torque of your implant. It can also be used for your abutment driver, and you can torque in your abutment at a desired torque. S-Clean system is very easy to use, and later on in clinic we're going to show you how it's done on live patients. So when it comes to implant motors, there are many options in the market. I personally like the X-Cube motor because it does the job and the price is very reasonable. But all of them practically have the same function. You have the saline bag that goes on a rod, you have the different settings on the implant motor that we'll go through in just a second, and you also have the foot pedal. On the foot pedal, you can change the programs that you've previously assigned to the motor. You can change the direction of the motor, reversed or forward. You can also change the amount of irrigation that you want coming out of the saline hose. Now, you also have the actual motor. So you can have, generally, you have two different attachments for this motor. You have your most used contra-angle, which is either normally a 32:1 ratio or a 20:1. And then you will, depending on which kind you buy, you will adjust your motor accordingly. You also have a straight handpiece that's usually used for bone reduction and whatnot, that are generally a 1:1, and then you will also adjust the ratio on the motor accordingly. There are also contra-angles that are 1:1. There are 45-degree surgical angles that are 1:1. There are many different options out there, but these are generally what's used the most. Now let's talk about the different programs and how you can set it. So on the digital display, you have these settings that you can customize. Top left, PRG is program. I have program 1 for myself. I have it set for osteotomy. Program 2 is for implant placement. Program 3 is for bone reduction. Program 4 is for osteodensification. But let's go through these programs one by one. So underneath program, we have PMP, which stands for pump. That's how much irrigation you're getting through. The 20:1 is the gear ratio, and that corresponds to the gear ratio on your handpiece. And this one, it's a contra-angle, it's a 20:1. Below it is the direction. You can have forward or reverse, obviously forward for osteotomy. Top right is the RPM. For osteotomy, you want the highest RPM that your machine allows you, because the faster you go, the less heat you're going to produce, lower chances of heat necrosis. And your Newton centimeters is the amount of torque that you're exerting. It's set at 40 Newton centimeters. This is my ideal setting for osteotomy. We go to program 2. This is for implant placement. Pump is at 0 because there's no more water coming through. My gear ratio and my direction they stay the same. But you want to make sure, this is important, that your RPM is dropped down to 30 RPM. You cannot be placing an implant at a really fast speed. And I have it set that at 45 Newton centimeters, my handpiece will stop. That is perfect torque and initial stability that you can get. It's ideal, so I have it set on that. Program 3 is set for a 1:1 ratio, gear ratio, and it's generally used for bone reduction. It's forward. You can have the pump. It's set at 2, but you can go up to 3 or 4 depending on how much irrigation you desire. And for myself, because I do osteodensification, that's the setting that's for the Versa drills, and it's recommended by the manufacturer, where you go in reverse at 50 Newton centimeters and 800 RPM.